Colonic diverticulitis or diverticuli. Diverticuli are small outpouchings which happen in the large intestine, which when get infected or inflamed, the condition is called diverticulitis. So why do these diverticuli happen? There are two main reasons. One, they can be present naturally, where we call congenital diverticula, or because of repeated constant straining in the motion, or because of repeated constipation, the pressure inside the large intestine is more, and thereby small outpouchings start developing in the large intestine. What are the symptoms of diverticulosis? Majority of the diverticuli do not cause any symptoms. They are usually detected during the course of a routine colonoscopy or during a scan done for a different purpose. If they develop any complication, then they develop symptoms. So what are the complications which can happen in a diverticulosis? They can get infected. If the diverticula gets blocked, secretions can accumulate inside that and they can get infected and swollen, and this can cause severe pain and fever. Rarely the infection can be severe, whereby the diverticula can burst, exactly like what happens to an appendix, and this can cause pus collection and life-threatening infection. The diverticula sometimes can develop bleeding, whereby the patient can have blood in the motion because of the diverticula. Severe cases of diverticular infection can cause fistula formation, whereby an abnormal connection can develop between the large intestine and a nearby organ like the urinary bladder or the small intestine, or sometimes even the uterus, and this is called a colovesical or a coloenteric fistula. These patients present with repeated attacks of pain and fever and infection. What is the treatment of diverticular disease? All diverticulae do not need treatment. If the diverticulae have been found incidentally or by chance during a colonoscopy and the patient does not have any symptoms, these people do not need any treatment. If a diverticula develops a complication like repeated infections or bleeding or fistula formation, then they need treatment. What is the treatment for diverticular disease? The treatment is surgical. Surgically, the part of the large intestine which has developed diverticula is cut and removed, and the remaining intestine is joined back. Is there a way to prevent diverticular formation? Yes. By adhering to good dietary habits, by avoiding constipation, by increasing the bulk of the stool, and by increasing fluid intake, the pressure which is generated inside the large intestine during motions is decreased, and thereby the diverticula can be prevented or they can be slowed down from progressing.